lymphoma at 29 years old. My oncologist, Dr. Sarah Chin, explained the treatment protocol. Aggressive chemotherapy starting immediately, 6 months minimum, possible radiation. You'll need strong family support, she said gently. This is going to be difficult. My mother sat beside me, Dr. Patricia Reeves, Director of Patient Services at Memorial Hospital. She checked her phone throughout the consultation. When does treatment start? She asked, not looking up. We need to begin within 2 weeks, Dr. Chin said. The cancer is advancing quickly. That's problematic. My daughter's engagement party is in 3 weeks. Can we delay until after? I stared at her. Mom, Dr. Chin just said. I heard what she said, Maya. But your sister's been planning this for months. We can start your treatments after the party. Dr. Chen's expression hardened. Dr. Reeves, with respect, delaying treatment could allow the lymphoma to progress to stage 4. That significantly reduces survival rates. I'm aware of cancer staging, Dr. Chin. I've worked in healthcare for 25 years. My mother stood, smoothing her hospital ID badge. We'll schedule around family commitments. Maya's situation isn't immediately life-threatening. She left before I could speak. Dr. Chin looked at me carefully. Maya, you're an adult. You can consent to treatment without your mother's approval. But I live with them. I need their support. What you need is treatment. Your mother is dangerously wrong. The family dinner happened 1 week before my scheduled chemotherapy. My sister Jade had just finalized her wedding venue, a destination ceremony in Costa Rica, scheduled for exactly 4 months away. Right in the middle of my treatment protocol. I pushed food around my plate, my appetite destroyed by pre-treatment anxiety and the weight of what was coming. The beach ceremony will be at sunset, Jade gushed, showing photos. Mom, you'll help coordinate travel, right? Absolutely, darling. My mother refilled wine glasses. It'll be perfect. My father nodded along. We're very proud of you, Jade. This wedding will be spectacular. I cleared my throat. Jade, I might not be able to travel in 4 months. Dr. Chin said. Oh, right, your treatment thing. Jade waved her hand. But you'll be done by then, won't you? It's just a few sessions. It's 6 months of intensive chemotherapy. Stop making a fuss about your little procedure, my mother interrupted, her voice sharp. Jade's wedding is once in a lifetime. Your treatment is routine cancer management. There's a significant difference. My younger brother Eric smirked. Maya always needs to be the center of attention. Something made me reach for my phone. I opened the voice recorder app, set it face down beside my plate, and pressed record. Mom, it's not routine. It's stage 3 lymphoma, which has excellent survival rates with treatment, she said dismissively. You're not dying tomorrow. Stop being dramatic and support your sister. Dr. Chin said delaying treatment even 2 weeks is dangerous. Dr. Chin is an oncologist, not family. I'm a healthcare administrator with 25 years of experience. I think I understand treatment urgency better than you do. My father nodded. Your mother's the expert here, Maya. If she says it can wait, it can wait. Jade smiled. Thanks for understanding. I need all my bridesmaids there. The photos won't work without you. I'll be in chemotherapy. I might not have hair. You can wear a wig, my mother snapped. Honestly, Maya. Cancer patients maintain normal lives all the time. You're just using this as an excuse to avoid responsibility. It's not an excuse. It's cancer. It's manageable cancer. Stop catastrophizing. He turned to Jade. Now about the bridesmaid dresses. I'm thinking coral to complement the beach setting. I sat there for 90 more minutes, letting my phone record every dismissive word, every cruel comparison, every time my mother used her healthcare credentials to minimize my cancer. When dinner ended, I had 47 minutes of audio documenting a hospital director telling her daughter that stage 3 cancer was routine maintenance and not life-threatening. Chemotherapy started the following Thursday. My best friend Carmen drove me to the infusion center after my family claimed they had prior commitments. The first treatment left me violently ill. I spent 3 days unable to leave bed, my body rejecting the toxic drugs designed to save my life. My mother called once. Jade needs your bridesmaid measurements. Can you handle that today? I can't get out of bed. You're being dramatic. People go through chemo and work full-time. Email her your measurements. She hung up before I could respond. Carmen found me crying in the bathroom after the second treatment, my hair coming out in clumps. "This is abuse," she said flatly. "Your mom's a hospital administrator. She knows how serious this is. She says I'm exaggerating. She's lying. And if she's lying to you, what is she telling patients at her hospital?" The question haunted me. I made an appointment with Dr. Chin. "I need your advice," I told Dr. Chin at my next checkup. "About something unethical I did." I played her the recording. My mother's voice, clear and cold. "Stop making a fuss about your little procedure. Routine cancer management. You're just using this as an excuse." Dr. Chin listened to the entire 47 minutes, her expression shifting from surprise to disgust to professional fury. "Your mother is Dr. Patricia Reeves, Director of Patient Services at Memorial Hospital." "Yes. She has administrative power over patient care policies. She influences treatment protocols. She trains staff." Dr. Chen's voice was deadly quiet. "And she's telling her daughter with stage 3 lymphoma that chemotherapy is routine maintenance that can be scheduled around wedding plans." I know it sounds bad. It's not just bad, Maya. It's medical negligence. But more critically, if she minimizes cancer this severely to her own daughter, how is she treating patients under her authority? She met my eyes. "I need to report this to the state medical board. Your recording, combined with my documentation of her interference, establishes a dangerous pattern." My stomach dropped. "She'll know I recorded her. She endangered your life. She's using her healthcare position to spread misinformation about cancer treatment. The board must know." Dr. Chin paused. "This is your choice. But as your physician, I'm telling you this isn't just about you anymore. She has power over vulnerable patients." I thought about Jade's wedding. The family that abandoned me to suffer alone. The mother who valued appearances over my survival. "Report it," I said. "Report everything." The medical board investigation began within 10 days. My mother received an official notice requiring her to submit patient files, treatment recommendations, and administrative decisions regarding cancer care protocols. My father called, screaming, "You reported your own mother? She could lose everything. Her career, her reputation. All because you're angry about wedding planning. She told me stage 3 lymphoma was routine maintenance. She pressured me to delay chemotherapy for a party. She was keeping family together. Preventing panic. You've destroyed her over a misunderstanding. I have recordings, Dad. 47 minutes of her minimizing my cancer and using her credentials to claim I was being dramatic." He hung up. The investigation moved quickly. The board discovered a disturbing pattern. My mother had been minimizing cancer severity across her entire hospital for years. She'd implemented cost-saving measures that delayed cancer treatments. She'd told staff that many cancer diagnoses are over-aggressive and encouraged conservative approaches. 3 patients had died after their oncologist's urgent treatment recommendations were overruled by administrative review. My mother's review. My case broke it open. The recording made it impossible to claim the pattern was accidental. 6 weeks into the investigation, my mother's hospital privileges were suspended. The board found evidence of patient endangerment, medical negligence, and abuse of administrative authority to interfere with oncological care. Jade's wedding plans collapsed. My mother was supposed to coordinate everything. Impossible while defending herself against charges that she'd contributed to cancer patient deaths through delayed treatment. Jade called hysterical. "You've ruined my wedding. Mom can't help plan anything. Everyone's talking about the investigation instead of celebrating me. I'm sorry your wedding got affected, but Mom told you to wait a few weeks for treatment. That's not a crime. You've destroyed our family because you couldn't be supportive for one event." She didn't just tell me to wait. She used her position as hospital director to claim stage 3 cancer wasn't urgent. The board found 3 patients who died because she delayed their treatment the same way. Silence. "Then, you're lying. The investigation is public record. Read it yourself." She hung up. The wedding was cancelled. My mother was too consumed with legal defense to plan destination ceremonies. My phone buzzed constantly with family members demanding I fix this and tell the board it was a misunderstanding. I blocked them all and focused on surviving chemotherapy. The medical board's ruling came during my 5th month of treatment. Dr. Patricia Reeves's administrative license was permanently revoked. She was found guilty of patient endangerment, interfering with oncological care, and implementing cost-saving policies that resulted in delayed cancer treatment and patient deaths. Her position as Director of Patient Services was terminated. Memorial Hospital faced 3 wrongful death lawsuits from families whose loved ones died after treatment delays my mother had authorized. She sent one email. I hope destroying my career was worth it. You've ruined your sister's wedding, our family's reputation, and my life's work. All because you needed attention during cancer treatment. I deleted it without responding. Carmen read over my shoulder during my infusion. She still thinks she's the victim. She'll always think that. In her mind, I'm the villain for exposing her instead of quietly accepting neglect. But you're winning. Dr. Chin says your scans show the lymphoma is responding to treatment. Because I got treatment despite her. I watched the chemotherapy drip. I survived her interference. That's enough. 8 months post-diagnosis, I completed my final chemotherapy session. The lymphoma was in complete remission. Dr. Chin called my recovery exceptional, given the initially delayed treatment start. Jade sent a brief text. Glad you're in remission. Getting married next year. Small ceremony. You're not invited. I didn't respond. My mother's legal battles continued. The wrongful death suits revealed she'd overridden oncologists' recommendations 17 times in 3 years, always citing cost management and overly aggressive treatment protocols. 4 of those patients died. 7 others had cancer progression requiring more extensive treatment than originally needed. My father divorced her, unable to handle the scandal. Jade moved to another state, changed her social media privacy settings, tried to escape association with the case. I started a blog about medical neglect by healthcare administrators. Connected with other patients whose treatment had been delayed by insurance companies or hospital bureaucracy. Became an advocate for patient rights and medical transparency. Dr. Chin invited me to speak at a medical ethics conference about administrative interference in cancer care. Your case changed hospital oversight policies nationwide, she told me. Administrators can no longer unilaterally delay oncological treatment without specialist approval. I stood on that stage, my hair growing back in soft curls, and told my story. My mother was a hospital director. She had the authority to influence patient care. When she told me my cancer was routine maintenance, she wasn't just being a bad parent, she was being a dangerous administrator. The recording proved she treated patients the same way she treated me. The audience of healthcare professionals gave a standing ovation. Afterward, a young doctor approached me. My hospital's director keeps pressuring our oncology department to reduce aggressive treatment recommendations. I didn't know I could report it until I heard your story. Report it, I said firmly. Patients die when administrators prioritize budgets over care. 2 years post-diagnosis, I was thriving. Cancer-free. Working as a patient advocate. Dating someone who'd never questioned whether my cancer was dramatic enough to take seriously. My mother's medical career was permanently over. She'd failed multiple attempts to have her license reinstated. The wrongful death suits had bankrupted her. She'd lost her marriage, her reputation, and her daughter. My phone buzzed one evening. My father, your mother is in therapy. She wants to apologize. She finally understands what she did. I looked at the message for a long time, then typed, I'm glad she's getting help, but I'm not ready to hear it. Maybe never. I deleted the conversation and continued my life, surrounded by chosen family, supportive friends, and medical professionals who'd believed me when my own mother wouldn't. The recording had been necessary. Dr. Chen's report had saved lives. And my survival mattered more than protecting a family that had valued a wedding over my cancer treatment. I'd learned the hardest truth. Sometimes the most dangerous medical neglect comes from people with credentials who should know better. But I'd survived anyway. And I'd used my voice to protect others from the same fate. That was worth everything I'd lost. Because survival isn't dramatic. It's revolutionary. 3 years after my diagnosis, I received an invitation to testify before a state healthcare committee reviewing administrative oversight reforms. My case had become the catalyst for legislation requiring independent oncology review boards. Administrators could no longer override cancer treatment recommendations without specialist consensus. Your mother's actions killed people, the committee chair told me privately. But your courage in recording that conversation saved countless others. I sat at the witness table looking at the panel of legislators and realized my mother was in the gallery. She looked smaller somehow, diminished without her hospital credentials and authority. Our eyes met briefly. She looked away first. Medical administrators wield enormous power, I testified. When they prioritize budgets or convenience over patient care, people die. My mother told me stage 3 cancer could wait for a wedding. He told patients the same lies about their treatments. The recording proved the pattern. After the hearing, my mother approached me in the hallway. Maya, don't, I said quietly. You had 25 years in healthcare. You knew better. You chose appearances over lives. Mine included. I was wrong. I've lost everything. 3 patients lost their lives. I almost lost mine. You lost your career. I adjusted my bag. Those aren't equivalent. I walked away, my steps steady, my health restored, my conscience clear. Some bridges burned.